Hi guys, and welcome to Daily Dental Hygiene. Today's topic is going to be about looking for those red flags when you are doing a working interview. It is so hard sometimes to see the red flags, and it's not until you've worked at an office for 2 months that you're like, holy crap, what did I sign up for? I have learned a lot of these lessons the hard way, and this is why I do these videos, is because I want you guys to be in really good environments. You are going to spend 9 hours a day at this practice. It deserves and it needs to be a practice that you feel happy and respected, and patient care and quality is up to the standards. So watch this video and we can break through some of the things that you're not taught in school, you're not taught anywhere except for learning the good old hard fashioned way. So I'm going to break that for you so that you don't have to learn the hard way. You can just listen to me and find a good office right off the bat. So, number one, I would never, ever, ever sign up for an office until you've done a working interview. That's like accepting to be in a relationship with somebody and you've never been on a date. What? Like, how would you do that? How would you know if you're compatible? How would you know if this is a good situation to even be in? You have to do the interview. It's not for them to see you. It is for you to see them. There's a shortage of hygienists and assistants and people out there in the workforce. You don't need them as badly as they need you. Trust me. So let's break through some of these things. Number one, look at the notes. Some offices literally don't even have notes. What does that say about the practice? Some practices, the dental hygienist will be like, plaque light, oral hygiene, okay, went over flossing, JML, signature. Half-ass the notes, literally no information about the patient, no probes, doesn't care. Just goes to show that the dentist allows poor quality notes and they don't mind poor quality care. Also, are there any probe levels on these patients? God, I can't tell you how many times I go to offices. There's no probe charts on these patients, yet they've had SRPs. So basically you're just either fudging all the numbers or like, I don't even know what you're doing. It's illegal. I don't even know what you're doing. I've seen offices where there's no x-rays, or they're 5 years old, or there's one PA from 2014 on a tooth that hurt. That's neglect. Like, what type of office allows that type of patient care? Not a good one. On top of it, how many dental hygienists are in each note? This is really important, and I wish I knew this one. Holy crap. I have worked at offices, and I have gone through the notes. Jennifer last time, Anthony the time before, Monica, Shelby. It's like every single time you go through the notes, there's a different hygienist. Ding, ding, ding. Why can't they keep their hygienist? Why is there a new hygienist in every single note? Why are there 12 different names? My last practice, there was 12 hygienists in 3.5 years. Says something about the practice, doesn't it? Why can't they keep a hygienist? Why is there somebody, even on the 3-month recalls, there's a different hygienist every freaking 3 months. Terrible red flag. And look at the other dental hygienist columns. I have done a working interview where I was given 8 easy pro-fees. The assistant helped me. All this seemed great. But I looked at the columns of the other hygienists on the other days. And even during that day, if there was another hygienist on, she was seeing 2 to 3 patients. I look at the other days, the other schedules, same thing. So what they were doing is they were being nice, showing me that they cared, giving me a nice, easy 8-patient schedule pro-fees. But once I got fast and comfortable enough, they were going to make me do what Margaret was doing, 2 to 3 patients an hour, and burning me out and using and abusing me. They were just trying to be nice that first day to just get me into the doors until I was trapped. Also, look at the reviews. Look at the Google and Yelp reviews. Are patients saying, granted, a lot of patients don't know dentistry. In fact, none of them know dentistry. They think they know dentistry. After Googling 5 minutes of something, they don't know dentistry. I went to this one doctor. He said I had no cavities, and then I come here and I have 6 cavities. And then I look at their x-rays. I'm like, Jesus, your last dentist was very neglectful. This dentist is actually diagnosing properly. So not always is the Yelp review exactly as it seems, but my very first dentist that I ever worked for, and I should have read the Yelp reviews because people were saying that he was charging, and I'm not even kidding you, $95 for a pre-procedural COVID rinse, hydrogen peroxide with Listerine. And patients were like, this guy's a complete freaking scam. And he was a total cheap dude in it for a couple bucks and did not obviously care about the patients. He was just trying to compensate for his overhead, charging $95 for hydrogen peroxide before the cleaning. What a corrupt person. God damn. Another thing to look at are the instruments. Oh, if you have to use these all day long, look at them. Oh my gosh, are there like no Cavitron tips? They're broken. The dentist, he's got nice new handpieces and nice burrs, but half of your nevies are broken. Everything is dull. It's just totally crap. That goes to show the dentist doesn't care about their hygienist. They don't care about the longevity of your career. They don't care about providing you with good quality instruments. Yikes, look at that. And if you really like the office and the instruments are bad, maybe at the end of the day say, listen, I really like this office, but these instruments are not acceptable and I can't work with these. I cannot do a good quality job for your patients with these instruments. And if they don't agree and say, okay, well, we want to have you on, I will buy you the instruments you need, run, because they just don't care about their patients and they don't care about you. Seriously, don't stick in an office with crappy instruments. It's not good for you, it's not good for your patients, and it is below the standard of care, and we don't do that in hygiene. On top of it, this is the most advanced tool that I have. It's called looking at the ledger. So it took me a while to understand this, and this is how you look at things like billing and insurance and stuff like that. If you have Dentrix, which is like the most common software for dental, and this is with other programs as well. Look at the ledger. A ledger is when you on Dentrix, it looks like a yellow sheet, like a yellow paper sheet, and it shows you all the billing. Prophy, $110, Bite Wings, $50, fluoride varnish, $30. It shows you everything that's being billed. And this is important because you want to catch this for corruption. Are they constantly billing improperly? Like you did a prophy, but they billed for a perio maintenance because they're corrupt? Did you do a prophy and they billed for a full mouth debridement because they are trying to get more money? I mean, do they overcharge? Like I know people that charge like $70 for Bite Wings. That's not cool. That's not appropriate at all. Like you just kind of look like what these people are charging. And this is a good way to see how often they are doing x-rays or how often they're doing fluoride or how often they're doing different things. This is the most important if you plan on working any sort of commission, because my last office, I did perio maintenances and SRPs, and they would be nice and bill the patients for like a prophy, $100 prophy, an $89 prophy when I did $150 perio maintenance. And I got freaking financially screwed. I'm like, wait a second. I did SRPs on that patient 3 months ago. They are a perio maintenance. And I just did a perio maintenance. And you just billed them for a $90 prophy? And I'm making commission off of that? You just screwed me $60. And it's insurance fraud on top of it. So that's a whole nother more advanced topic. If you're a more advanced hygienist, that will make more sense to you. If you're young and kind of starting off in this career, you'll learn that, and hopefully not the hard way, but yes, you will learn that. Offices, a lot of offices do not bill correctly, and if you work commission or any sort of like bonus system pay, you will get so screwed if they don't bill properly, because you could do stuff all day long and they're just freaking not billing for crap, and you're not making crap, and it's illegal, and you get totally jacked on the pay. So look at these red flags, because I have learned the hard way in so many situations. I just don't want you guys to ever be in some of the offices I've been in and been unhappy the way I've been, because this can be an awesome career. It can be a dumpster fire. It is all dependent on the office and the dentist that you work for. Seriously, it makes or breaks. Just like a relationship, right? If you have an awesome husband or an awesome husband or boyfriend, it could be great. But if you have someone that is verbally, physically, mentally, and emotionally abusive, it's terrible. It makes the night and day difference. So please use these red flags and learn how to protect yourself and the longevity of your career and your happiness, most importantly, your happiness and your moral compass. Bye, guys. Thank you for tuning into Daily Dental Hygiene.